Hi and hello, everyone. My name is John Sheehan. I'm an Associate Director of the Healthy Brain Initiative for the Alzheimer's Association. And welcome to today's presentation, Chief Health Strategist, Embedding Caregiving Across the Full Community. I'm very excited that you can all join us today, and I hope it's an informative time for you all. Today's webinar is going to accomplish a few different things. The first is that we're going to examine a Chief Health Strategist approach and how that can be actually applied to the topic of dementia caregiving, what that approach can do to better support caregivers for people living with dementia, and how we can embed support and caregiving into community policies, systems, and environments. We're going to hear about some excellent resources and tools that can support this work, and we're also going to hear how a few states have actually utilized this approach previously. Before we begin, just a few housekeeping items for everyone's knowledge. Please do know that we are recording today's webinar so that it is available not only for those that couldn't join, but for anyone that didn't register ahead of time. In the coming days, we will send out a copy of the slide deck, a link to the recording, as well as all the featured links that you're going to hear about later today. Throughout today's presentation, if you have a question or a comment, please use the Q&A box to submit that. We do have designated time at the end of the session to go through all questions. So please use that feature at any point during today's presentation. And I would like to acknowledge the Centers for Disease Control and Prevention, whose cooperative agreement allows us to hold today's presentation. But please do be mindful that the thoughts and opinions you hear expressed today are solely those of the speakers themselves. And before I turn it over to our first speaker, let me launch this poll. And if you would just take a quick moment to let us know what your area of focus is. It's always great for us to kind of know who we're reaching and how we can better support the public health field, working in cognitive health, dementia, and caregiving concerns. So take a moment to fill out that poll. And in the meantime, I'm very excited to turn it over to our first speaker, Dr. Lisa McGuire.
Thank you very much, John. All right, so I'm going to talk just a little bit today about dementia caregiving and why and how the chief health strategist can be really important. So today we're referring to a joint publication or a joint product between CDC and the Alzheimer's Association, which is an action brief that describes many of these concepts that we will all be describing today to you. You can see the link for the framework is at the bottom of the slide. But really the role of this and wanting to get public health thinking about its role within dementia caregiving is we know that through strong public health leadership, we know that it's essential to engage community partners that really can drive those structural changes that really can support effective, sustained caregiving for people living with dementia, and also a lot of assistance and care for their families as well too. Next slide, please. So what is this chief health strategist approach? So this is a way to address some of the most pressing health issues strategically and to improve both the health and well-being equitably. So taking into account many of those social determinants of health, as well as focusing on that public health approach, which focuses on policies, systems, and environments, and really tries to embed the change through those mechanisms for sustainability. So what else does this approach entail? It entails using data and the best available evidence that is available. It's really also about engaging and collecting feedback from the community. So not only assuming what we think people need, but finding out what kind of things would be useful for them. What really are their needs, not just our perceptions of it. And also reducing disparities as well too. Next slide. So here's a little bit about the burden of caregiving in the US. We know that in 2020, more than 11 million family members and friends provided some type of care or assistance that is unpaid to people who are living with Alzheimer's disease or related dementia. This is, as you can see here, 15.3 billion hours of that unpaid care. We know that more than 1 in 2 caregivers for people living with dementia are employed or self-employed, and that 40% of caregivers for people living with dementia live in households that have an annual income of less than $50,000 annually. So what we're looking at here is we're seeing that a lot of people are providing care, many of which it is not necessarily their full-time job to provide that care. They're providing care as a family member or friend. Next slide, please. So how can public health address some of those challenges and some of those disparities? So one of the things that we know, some of the challenges to those effective dementia caregiving is limited knowledge. More than half of all caregivers have little or no knowledge of support services in their communities. So in other words, you may not necessarily be aware of what's going on in your community or the supports that are available to you until you need it. And then that is a time not necessarily to spend time trying to figure out what's available or how to gain access to it. So people don't necessarily know the services that exist. There may be confusion of how to get to those services, concerns about the cost, fears related to being institutionalized, or perceive that you're not going to be matched appropriately to the needs that you have. Next slide, please. One of those other challenges is the fragmentation of services. We know that some of the service delivery is very patchwork, and sometimes it can be very difficult to navigate. Sometimes there's too few care providers to make referrals or provide services, and sometimes there's really, really long wait times or a lot of paperwork involved to obtain those services. Healthcare providers often don't know what services exist within their community, and sometimes there's challenges of figuring how to connect their patients and clients to those actual services. Next slide. We also know that there's gaps in equitable access to these interventions, services, and supports. Many times this is the result of inadequate funding, inadequate program structure and locations, and sometimes the services that are available may not meet the cultural needs of the people who need those services. Next slide, please. So I'll turn it over to my colleague, John Sheen, who's going to tell us what the solution is to all of these challenges.
Thank you. Thank you so much, Dr. McGuire. And I think the case there that Dr. McGuire laid out so beautifully is why a chief health strategist approach is really beneficial to address dementia caregiving in communities across the country. And one of the things that I think is helpful to consider and to think about is kind of what the aim of an overall chief health strategist approach to this topic can accomplish. And really aiming to create communities that have caregivers that are well-trained and well-knowledgeable on how they can not only provide excellent care to the care recipients, but how can they maintain their own health and well-being while providing that care. This can also be a community where the healthcare provider workforce understands how and when to involve caregivers in care planning services to those care recipients. It also includes a healthcare provider workforce that understands when and how to help caregivers support their own health and well-being. And it also includes the broader community. How can employers, for instance, initiate supportive policies and practices that are accustomed and attuned to caregiver needs? And so the public health approach, the chief health strategist approach here that we want to highlight really looks at the unique capability, the unique capacity public health has to utilize this for specifically addressing dementia caregiving. And the first strategy that you see there is convening. Ensuring that those who are most affected by dementia, by caregiving, are at the table and are heard from. Public health works to educate, just as I said, both caregivers themselves on supports and services that exist, as well as the healthcare provider community to better support caregivers in their roles. Classic public health example is a needs assessment process, utilizing this chief health strategist approach to initiate a thorough needs assessment to identify existing resources, identify gaps, and illuminate the inequities that we see in the burden of dementia caregiving that Dr. McGuire just highlighted. Kind of completing the assessment process includes a thorough planning process, finishes with a thorough planning process, culminating with actionable steps that utilize kind of the great needs assessment information that was just collected to advance the most pressing needs for caregivers. And so this, in totality, this chief health strategist approach is an excellent way for public health practitioners to fully embed and fully consider the unique needs that caregivers face when providing care to someone living with dementia. The brief itself offers much more detail than we're going to cover today, so I encourage everyone to check it out, and we'll have links at the end of today's presentation. But the brief itself highlights 6 strategies that align with this chief health strategist approach that advance dementia caregiving as a subject. The first is really about access, both improving access as well as increasing the use of supports and services. When we pull back and we think about it, chief health strategists can set goals, for instance, to increase access and map out how to improve access, particularly to those that are most underserved caregivers in their community. Related to that, and the second strategy illuminated is about assessment. This is both conducting an initial assessment on caregivers, who they are, where they live, what supports and services they need, but also includes routine assessment in the years after of caregiving and dementia caregiving in the community. Chief health strategists using this strategy can prioritize how to individualize services to caregivers, again, to those most underserved, while respecting cultural competence for unique needs and strengths. The third strategy advances the impact of this approach by affecting change at the PSE level, the policies, systems, and environmental level. Specifically, these can help reduce that burden that we just heard described from Dr. McGuire. Chief health strategists using this strategy can implement policies or support environmental changes that improve, for instance, employer practices around caregiving. Here also ensuring that cultural competence and cultural context are fully considered when those PSE level changes are proposed. Continuing along, our fourth strategy, utilizing a chief health strategist approach, is on that classic public health function of data and evaluation. Tracking, analyzing, and then using that analysis to promote caregiver health and well-being. Just like the assessment strategy, chief health strategists can ensure that this is a routine process accomplished on a regular basis to fully utilize that approach and fully utilize that power of public health. And our final 2 strategies are related, but take 2 different tracks. The fifth strategy that we have identified here is on emergency response and emergency preparedness. This includes like natural disasters, but also, as we are all intimately familiar with, like pandemic response. Here, chief health strategists can ensure that caregivers are still able to access their care recipients during an emergency and continue providing that essential care that they do. This relates back to that 4th strategy, those PSE level changes, particularly around emergency response planning efforts, since I know this is something that a lot of public health agencies and a lot of public health officials have as a continued priority at this moment. Our 6th and final strategy, outlined more thoroughly in the brief, aims to improve community understanding and community respect for caregiving, enhancing the community impression of caregiving to then affect some of those larger PSE level changes and promote respect for caregivers. A few additional items that I want to highlight that we actually have in the brief before I turn it over to our next speaker are resources that public health practitioners can use to advance this chief health strategist approach to dementia caregiving. For instance, you'll be able to find evidence-based interventions, and I'm excited that we'll have a speaker talk more specifically about a few of these in just a few minutes, but we'll also find sample assessment questions to fully comprehend the scope, the gaps, and the inequities that exist within the community as far as dementia caregiving is concerned. Another resource contained within the brief itself is a case study about how one state utilized a chief health strategist approach to improve outcomes for caregivers living in Arizona. This is a perfect segue to our next speaker, who's going to talk about more state initiatives in this arena. And so it is my pleasure to turn it over to Megan Fidel.
Hi, thank you so much, John. So we wanted to share with you a few ways that health departments have put caregiver health and support initiatives into action, while also acknowledging a lot of work remains to be done in this area. So two state health departments that have made inroads to working on this topic are the Arizona Department of Health Services and the New York State Department of Health. In Arizona, on the next slide, you can see that recognizing this was a public health issue, the Department of Health Services began their efforts by compiling and analyzing any and all available data to be able to identify and communicate the scope of the issue. Following this, they convened a variety of stakeholders, including various provider agencies, funders, and others, to brainstorm how organizations might be brought together to encourage better coordination of services. And they were able to build consensus to create a coordinating body. In 2018, they launched the Arizona Dementia Caregivers Alliance, made up initially of 15 provider organizations, and all with the shared mission of improving access to comprehensive services for caregivers. On the next slide, you can see that their approach had three overarching components, including caregiver support, a universal helpline, and linkages to care. They chose these three areas thinking that they held the most promise to improve the lives of caregivers and also offered scalability to the rural and frontier regions of the state. In the next slide, just to talk a little bit more about each area. For caregiver support, they collaborated with an organization called Duet Partners in Aging and used a train the trainer model to offer peer-led training. On the next slide, you can see with the Universal Hotline, they enhanced and linked to existing phone and online resources, including the Alzheimer's Association 24/7 helpline, as well as the Community Resource Finder, which is an online hub. And through that, they were able to expand and improve coordination and navigation of services. And lastly, on the next slide, they worked to adapt a rapid referral model used in HIV treatment and support to help providers better identify caregivers and more quickly link them with existing services. So this gives you a just brief snapshot of what Arizona did to support caregivers. On the next slide, I want to turn for a moment to just briefly highlight what's been done in New York State. So New York has a long history of action, beginning in 1984 with the creation of an expert panel to help inform their work on dementia. Similar to Arizona, they convene stakeholders, and that's been a cornerstone of their work with the ongoing coordinating council for services related to Alzheimer's disease. While services began in the 1980s, it was really in 2015 that the annual funding for caregiver support dramatically grew to over $25 million investment annually. On the next slide, you can see that they chose to invest those funds in a two-pronged effort with a portion focused on community support and education and funding community agencies through grant programs to ensure reach across the state. Those grant programs included the Regional Caregiver Support Initiative, the Alzheimer's Community Assistance Program, and the Caregiver Support for Underserved Communities Initiative. They also funded 10 centers of excellence to serve as the gold standard in dementia care and to train healthcare professionals on early detection and quality care. On the next slide, you can see some examples of the services that were funded through these grant initiatives. They included care consultations, education, support groups for caregivers, respite programs to offer caregivers some time away, as well as a 24-hour helpline. And on the other side, through their clinical programs, they offered assessment and diagnosis, care management, medical and healthcare provider training on a variety of different topics, and the promotion of clinical trials as well. Last but not least, this initiative made sure to embed evaluation into their work by working with external evaluators at the University at Albany. They were able to demonstrate some positive findings. In addition to offering benefit to individual caregivers, the impact of the initiative included an expanded reach to caregivers and people with dementia across the state, a strengthened infrastructure and enhanced workforce, as well as a more coordinated provider network. And we can turn to my last slide. I just want to point out that these are examples from 2 states, and you can see some of the ways they've implemented strategies that John described. There's so much more opportunity for state and local action on caregiver health, and so we hope that you'll take what you've learned today and apply it in your own community. Now I want to turn it over to David, who will share some valuable resources with you.
Thank you, Megan. I'm going to talk about Best Practice Caregiving, which is an online resource of evidence-based dementia caregiving programs. And these are resources for family and friend caregivers. Next slide, please. This is an initiative that's a partnership between Benjamin Rose Institute on Aging, which is where I'm a vice president there and senior scientist, and it's in Cleveland. Family Caregiver Alliance, a San Francisco nonprofit organization focused on family and friend caregivers, the Gerontological Society of America, and Bridge Builder Strategies. And you can see on here our wonderful funders, the John A. Hartford Foundation, RRF Foundation for Aging, and Archstone Foundation. Next slide. I wanted to start off with this slide. There are 14 categories of assistance that caregivers have told us that they look for support. And I put these on here just to kind of give you a sense of the breadth of issues that caregivers face. We know that dementia affects so many domains of the person with dementia's life, as well as the family and friend caregivers' lives. And when you look down this list, you really get a sense of the diversity of issues that caregivers are seeking help for or would be interested in getting help for. Next slide. Now, I believe there's been a major advance in the field of caregiving. And over the last 30 years, there's been a great deal of research and program development around non-pharmacological programs that support or benefit family and friend caregivers. And the field has come a long way. And so my presentation really builds on this success, because now there are some very good solutions to some of those issues and problems that caregivers would like support with. And some of these programs also have proven benefits for persons living with dementia. Next slide. The problem is we have many programs that have been proven in controlled research to benefit family and friend caregivers. And as I said, some also the person living with dementia. But few of these programs are really widely available across the country. Most healthcare and community service organizations don't offer any of them. And again, these are programs proven effective in research and ready for community implementation. And as a result, most family and friend caregivers can't access these programs, even if they knew about them, because they're not in their communities. Next slide. There are a number of reasons why these programs aren't more widely available, but one of them, which really caused us to generate Best Practice Caregiving, this online resource that I'll tell you more about as I go through my presentation. One of the reasons was it was hard to find information about these programs. And I'm really talking about organizations, healthcare organizations and community organizations, people working in those organizations, how they could find out about these proven programs that have been tested and shown to be effective and efficacious, and yet not widely available. So this isn't the only reason that these programs aren't widely available, but the lack of knowledge about them is one. And one of the challenges before Best Practice Caregiving was that there was no one source, one comprehensive, updated, single source of information that people working in healthcare systems and community organizations could go to find out which programs to consider for implementation. You could go to the research literature, the published literature in scientific journals, and you could find research articles on these programs, but finding those articles, that isn't easy. If you do find those articles, what you don't find in them oftentimes is detailed information about the practical things that an organization looking to start a program would need to know if they were going to select one of these programs. So from those research articles, it's often difficult to know what's the best match for my organization. Which of the programs is ready for a community implementation, not as part of another research study, but which are ready to be used in communities and actually have been used in communities before. And those programs that have been implemented in communities, how did it go? Was it Were they able to enroll caregivers? Were the staff able to do the program? What resources were required? So these are all the issues that organizations still face, but now best practice caregiving is a resource for them to go to. Next slide, please. Best practice caregiving was launched in January of 2020. It's an easy to use online tool for professionals. And I want to stress that the tool was developed for professionals in its current form. It includes now 44 of the top evidence-based dementia caregiving programs. If you go to the website, you'll find comprehensive program profiles for each of the 44. It gives you detailed information on all the implementation features of those programs. Things like, what are the manuals like? What kind of training is provided by a program developer for an organization that starts a program? What kind of marketing tools are available to try to attract caregivers to use the program? So detailed information about all the different implementation features. It includes information about the experiences of service organizations that have tried the programs in their communities. So we actually surveyed all the organizations that were delivering one of these 44 top programs to understand how they did it, what their challenges were, what their successes were. And that information is summarized in best practice caregiving. We do, in best practice caregiving, include key features from the research studies that establish the evidence base for the programs. It's not everything about the research, but it's really selected things about the research, the types of outcomes that were impacted, for example, the kind of methodology that was used in the studies. We also include links to all the published articles for each program. So you can go to Best Practice Caregiving and you can click on a link that'll show you all the articles that have been published for each of the 44 programs. And finally, this seems very simple, but it's actually challenging. It gives you contact information for who to contact if you want to start one of these programs. We had a hard time finding that information. And nothing is more difficult than if you can't track down who distributes a program or who will give you permission to replicate a program or who would provide training if you try to do the program. All that information is now there in Best Practice Caregiving for these 44 programs. Next slide. I want to talk just a minute about the eligibility for inclusion in Best Practice Caregiving. And I'll start by saying we don't have all the programs that are eligible. We've got 44. We think there's probably another dozen or so programs that we're hoping to add that meet our eligibility, but they're not in there yet. So to get into Best Practice Caregiving, there had to be at least one controlled research study that included at least half the sample with family or friend caregivers of persons living with dementia. They had to be people living in the community, and there had to be at least one statistically significant published beneficial caregiver outcome. So this first criterion is sort of the research criterion in order to get into Best Practice Caregiving. The second criterion isn't a research characteristic, it's really about community implementation. So every program in Best Practice Caregiving had to have at least one implementation, meaning delivery in a community that wasn't part of a research study, a real world implementation of a program, at least once. And third, each program had to be available for replication. So there had to be somebody who could give permission or a license to do the program in another location, or provide the tools that are necessary to deliver the program. Next slide. We had some guiding principles. We have a very inclusive definition of evidence-based. So we include some programs that don't have a randomized controlled trial. We include programs that were tested with pre-test, post-test studies that met the research criteria of a published statistically significant beneficial outcome for caregivers. And that means some programs, some people would say you'd have to have a randomized controlled trial or it doesn't qualify as an evidence-based program. We didn't stick to that. We opened that up and have a little looser definition to include studies that were non-randomized trials and studies with pre-tests, post-tests only, as long as there was that published statistically significant finding. We decided not to rate programs or grade them, but rather provide the user of best practice caregiving with all the detail they could want. So we didn't make subjective ratings. If a program qualified, what we did was try to put into the best practice caregiving profile everything you'd want to know as a user of the website, and then it'll be up to you to make the decision about whether a program matches your organization, or if you're looking to implement, that assumes you're looking to match to your organization. We emphasized both the implementation characteristics and the research characteristics. We wanted everything that an organization needed to do to take a next step of considering or possibly actually implementing a program in their communities. And while we focus on what programs are available now and ready to be delivered, we also have been identifying gaps, because although many of the areas that I started my presentation with, those areas are categories of assistance that caregivers look for, many of those areas are addressed by many of these programs, but not all. So we're going to be identifying key areas or gaps where we need new programs that we don't have now. Next slide. Here's a list of the 44 programs that are currently in best practice caregiving. And I say currently in, I say that because we're adding some programs as we speak. There'll be an additional 5 to 7 programs added over the next few months. They're all programs that will have met the eligibility criteria. If you know of programs that meet the eligibility that aren't listed here, I would greatly appreciate you letting me know. My email address is at the last slide. We want to find all the programs that fit our eligibility. And as I said, we'll be adding several more programs over the next few months. But this is the number that are in the website. If you go to the website right now, you'll find all these programs in there. Next slide. One thing that comes out as you look at these programs is, although there are 44 of them and they're all programs that benefit family and friend caregivers and have been implemented in a community, they are not all the same. These programs do many different things for caregivers. They address many different areas of assistance that I started with. Very few of the programs address them all. The programs address those areas of assistance in different ways. Some of them help directly. Some of them just provide information about where you can go to get a program. Some of them just provide information. So there's different ways they help. They help with different things. And if you were really trying to create a comprehensive network or fabric of caregiver support programs, you'd have to do more than one of these programs and put them together. We tried to give everything you would need if you're an organization. If you want to know about the staffing requirements, how many sessions programs had, how they're delivered. There's been great interest in programs that are delivered remotely as we face the pandemic. That information is there. There are 13 programs that are remotely delivered and more to come. The number of enrollees that you can expect to get if you do these programs based on the experiences of other organizations that have tried them, as well as what the developers of the programs tell us. How much does it cost to deliver a program? Is there a cost for the license? What kind of staffing is required if you're going to hire a person to do it? What are the credentials of that person? Are there any sources of reimbursement, third-party payers that would cover some of those costs? All that information is there. So we hope from best practice caregiving, if you're an organization, you'll be able to assess what's compatible with our mission, our resources, our communities, and consider choosing a new program to implement so more families have access to these proven beneficial programs. Next slide. Just to tell you a little bit about where we're at with best practice caregiving is that we have had around 35,000 users in the first 18 months after the launch. Best practice caregiving is housed on the Family Caregiver Alliance website. The link to that website's on my last slide. It's at caregiver.org. We have a lot of marketing and publicity that we're doing, presentations like this, but also we have a newsletter, blogs, infographics. We're trying to do everything possible to make people aware of this free resource. We're hoping to start a new expansion in 2022, where we're going to try to create a version of best practice caregiving that's not for professionals, but it's really for family and friend caregivers to find programs in their communities and know how to enroll in those programs. One of the findings we had from the original best practice caregiving is that there are 400 to 500 organizations across the US that are delivering one of these programs or more. That's more organizations than we thought were doing these programs. And some of those programs are being offered to people anywhere in the US, especially programs that are delivered remotely by telephone or computer. So there are programs in almost every community in the US that are on our list. If you're a caregiver, the new version of best practice caregiving, the consumer version that we hope to create, will be a place where you can go to find those programs in your communities and know how to enroll. And that's our next phase of development. We are also expanding greatly the information about programs that have been developed or adapted for diverse populations. We don't have that in there now. We have information about whether a program's been translated, but we haven't dug deep into how programs have been adapted for which diverse populations and how those adaptations came about. We're going to be adding that information as we move forward. And now we're also looking for sustainability partners, and we actually have a few now. Sustainability partners are necessary for us because we want to keep this information up to date, and we want to keep adding new programs that become eligible. So we're looking for organizations to become partners in this with us, and it's a sponsorship model. So if any of you are with organizations that might be interested, please keep this in mind, especially as we move to the consumer tool. It's going to be a great resource for people all across the country who are in caregiving situations for people living with dementia. Next slide. This is my last slide. It's just a list of our project leaders and the websites at the top. Please go to Best Practice Caregiving, bpccaregiver.org. I hope you'll check it out. Please don't hesitate to email any questions that you might have about it. Back to you, John, and thank you for the opportunity to present.
Thank you so much, Dr. Bass. This is one of the reasons we wanted to highlight this resource is because as we're seeing in the Q&A, a lot of people out there don't know that this resource exists, don't know that services and supports specifically for caregivers exist in the capacity that they do. And so we really wanted to highlight the excellent compilation, the really thorough research, the really thorough development of the best practice caregiver database, because it is such a wonderful tool for those professionals who are looking to implement programs related to dementia caregiving out in their organizations and in their jurisdictions. So thank you so much for that. To let everyone know, we are nearing the end of our presentation today. We do have quite a few questions that have come in via the Q&A box. If you do have a question, please feel free to enter it right now. We'll get to as many as we have time for today. But before we get to Q&A, I do want to highlight just a few additional resources. In addition to the best practice caregiver database, please make sure to check that out. The link is in the chat right now. And on the next few slides, you'll see links to the actual caregiving action brief, as well as a new executive summary. But before those come up on the screen, I do want to take a few of the questions that have come in from our wonderful audience today. So if I can have the panelists kind of come back on screen here. The first question that we have, actually, I'm going to address kind of two questions in the same issue. And it really centers on the chief health strategist approach and how a chief health strategist can interface with both dementia services coordinators within a state agency, as well as area agencies on aging. And so I'll take the first crack at this question, but any of the panelists, please feel free to weigh in on this. Because the way that chief health strategist is kind of framed, it's a framework. It's part of Public Health 3.0, which is kind of the current elevation of where the broad public health field is and how it approaches the work that public health is charged with doing. Public Health 3.0 is really about embracing a multi-sector collaboration. So making sure that folks from public health are included and represented. Folks from the community that they represent are represented and assessed. People from the aging community, people from the employment community, and kind of every sector that helps contribute to the health and well-being of individuals, that they are included in the public health approach. Because it's, as we learn every day, everything that we do is connected to one another. Our health is connected to the social determinants of health. And we have, there's so many different facets between work, between access, between pollution, between the built environment, that really impact and influence the way that people go about living their best healthy lives. And so Public Health 3.0 and the Chief Health Strategy approach is really designed to bring that community together to address those social determinants of health and improve overall health and well-being. And so I bring that up because the chief health strategist, you heard me say that phrase many times today, and this could be, it could be one person. It could actually be like a funded kind of position within a state health department, a local health department, a public health organization, or it could be a more generic approach, the chief health strategist approach. And so there could be a lot of different folks who are involved in that multi-sector collaboration, in that social determinants of health work, that are working towards this chief health strategist approach effort. And so I bring that up because the area agencies on aging and the dementia services coordinator, as well as many other public health practitioners, they're all involved in that multi-sector collaboration. And so there is certainly a role and responsibility for each to do in Public Health 3.0 in this chief health strategist approach to dementia caregiving, making sure that those most impacted by today's topic, by dementia caregiving, are included, are assessed, and are routinely involved in the work to better improve caregiver health and well-being. So I'm gonna pause there and see if any of our other panelists would like to add anything to the chief health strategist approach and how it might interface with other public health practitioners or other aging officials. Excellent. All right. So Public Health 3.0 is something that I continue to learn about more each day. And this chief health strategist approach is really exciting because it does have that cross collaboration, that cross sector collaboration that really tries to get at the whole person approach and a whole community approach, which is very exciting to see. One question that we have is for Dr. Bass. Is there a way to, in a best practice caregiving database, to search by disease condition or to search by language availability or other considerations?
Yes, we have a filtering capacity in the website for both of those characteristics, as well as many others. So there's a lot of search functionality that makes it easy to use.
Excellent. And I know that I've poked around quite a bit in the database, trying to not only understand and get a scope of the interventions that are highlighted, but just kind of understand what search options are out there. So if you check out the chat, I did put in how you can look through specific programs and what some of those filters are, but do take a chance and do take some time to look through the database, because it is incredibly thorough and a wonderful resource for all our public health practitioners on that call today. And it looks like we have some additional questions come in related to kind of where some of these efforts have occurred. So Megan highlighted efforts that we know about in New York State as well as Arizona. And we highlighted those two examples because they really do embrace this idea of chief health strategy, of Public Health 3.0, of having this multi-sector collaboration, look at, assess, and implement action to really improve the outcomes and the health and well-being of caregivers. But we know that there's a lot of other efforts that are happening at the local level in other states that do work to address dementia caregivers as well as caregivers for people with other conditions, but haven't necessarily reached the level of this chief health strategist, the embedding dementia caregiving throughout policy systems and environments, kind of using that full public health 3.0 approach to expand the reach and expand the impact as thoroughly as we've seen in New York and Arizona. We of course don't always know about everything that occurs. So if your state or your jurisdiction has done this approach, we would love to hear more about it and learn some of the details. But we know that this is a growing area of interest for a lot of public health agencies on the governmental side, but as well as other nonprofit public health organizations. So I expect in the coming years, we'll definitely see much more uptake of organizations and agencies undertaking caregiving as a public health issue, really to expand that reach, fully address the needs and reduce those inequities that we know exist. And last question here is about just the logistics of today's webinar. As you see on the screen, everyone that registered for today's webinar will receive a copy of the slide deck, a link to the recording, as well as the links that we had featured today. And to answer the question that just came in, feel free to share that with as many people as you would like. The more people that have this information, the better. No need for those individuals to register, but please feel free to share with your colleagues in the field. I think that will conclude our Q&A session for today. So thank you so much for asking those questions. Just a few final things to close out today's presentation. The links that you see on your screen, this will be in that follow-up email. The full action brief highlighting this chief health strategy approach to dementia caregiving is available from both the Alzheimer's Association as well as CDC. And we just went up yesterday, a shorter 2-page executive summary highlighting the actions and the strategies of the brief that is currently posted on the association website and will be coming soon to the CDC's website too. And those you can see on your screen here. Please make sure that you check out some additional website materials on public health and the interface with dementia, cognitive health, and caregiving, alz.org/public-health, cdc.gov/aging, as well as the best practice caregiver database at bpc.caregiver.org. I am going to, well, of course, I copied and pasted the wrong thing. I'm going to quickly put in a feedback form to the chat. This really helps us improve the services and the webinars, the presentations that we offer. If you take just a minute or two to fill this out, we'd greatly appreciate it. And thank you so much for joining us for today's presentation. Take care, enjoy the rest of your weekend. We look forward to connecting again. Take care, bye-bye.